Today, we're going to be discussing how mold can affect a female's hormones and their menstrual cycle. So many times women, develop all these weird symptoms that send them to their OB doctors, and they don't know really what's going on. And they're told that potentially they have, endometriosis, they need to get on birth control, they have thyroid issues, when really it's just mold causing them to have these symptoms that sent them there to begin with. But because doctors aren't testing for mold exposure, they don't know that it is mold. And then unfortunately, a lot of women go through unnecessary surgeries, get put on unnecessary medication, and so forth. Today, we're here to talk about how mold affected us personally in our hormones and our menstrual cycle. We are joined by Elizabeth Cripe and Lauren Cloud. And we're going to start with Elizabeth and learn about how mold affected her personally. Hey, Elizabeth.
Hi, Emily. Hi, Lauren. So in December of 2017, we moved into an apartment that, unbeknownst to us, had toxic mold. Between the time frame of December 1st and July 9th, I ended up in the emergency room between 4 to 5 times, specifically for abdominal pain, a lot of pain where my ovaries are, and pain that was unbearable. And I have a very high pain tolerance level. So my husband was very concerned. I was very concerned. At the time, we were also seeing doctors and being put on multiple rounds of antibiotics because they weren't sure what was wrong with us. And every time I went to the emergency room, they did ultrasounds, they did testing, and they informed me that they thought a very large ovarian cyst might have burst. And that was the cause of my pain. But other than giving me some pain meds and sending me home, they could do nothing for it. So parallel to this, I'm seeing one of the top OBGYNs in our area. I decided to try and start to see this person, and they did the same testing. They did the same consults, met with me multiple times, and came to the conclusion that they thought I might have endometriosis, which at the time was a relief. Like, yes, I had an answer. There was something they could do to fix it, until one of my follow-up appointments to that initial consult. And they said, well, it might be, but we need to operate to find out. And your pain is so bad that while we're in there, we might need to do a partial hysterectomy. And those were not words I wanted to hear in my early 30s. Like, nobody wants that done that soon. So my husband and I talked about it. Mind you, we're in mold mind at this time, so a lot of brain fog. And we said, well, if we have to do that to take care of this, we'll do it. We just were very concerned that the doctor didn't give a concrete diagnosis. So we waited a little bit. Then our apartment was finally diagnosed with toxic mold at very, very high levels. And my daughters and I flew to California to stay with my family and detox and regroup. And the pain kept coming back. And so I said, well, I'll get a second opinion. Like, maybe somebody here knows what's going on. So I saw an OBGYN here, and quickly, very quickly, like my second meeting with him, he said, you have excess scar tissue that should not be there. I'm not sure how it builds up this quickly in your uterus, and you need to have an ablation, and you need to get the scar tissue removed ASAP. And I said, do I have endometriosis? He said, I'll go in and check, but it doesn't sound like you do. He said, do I need a partial hysterectomy? He said, no, you don't need a partial hysterectomy. We just need to go in and remove the scar tissue. And that should take care of the pain, and the ablation should stop your menstrual cycle for a little bit to let your body regroup. This was like amazing. So we did the procedures in California, and sure enough, the pain, I'm now 4 years out from that procedure. And I just in the last 2 months started to have menstrual cramping, but very, very minor, and started to have a menstrual cycle again. So I look back and I'm incredibly grateful for the process because it led me to here. I'm incredibly grateful we didn't do any operations in our original location. I didn't need that part of me removed. My hormones were already freaking out, and going through that procedure and finding out now some of the other conditions I have, I wouldn't have been able to take the medication and the hormones that would have been needed after the partial hysterectomy. So it was exhausting to go through, to have that much pain. And I was diagnosed with PCOS after I did not have that before. I was diagnosed with PCOS now. But yeah, that was my journey. And it's horrible. You don't know in the process, right? You don't know what's going on. You just know your body hurts. You know, you can't move. You know, you feel like things are erupting in your ovaries. And yeah, so that's my process.
How
Wow.
did all your pain start when you moved into that apartment? Is that where it all started?
The extreme pain did. So growing up, I've always had very heavy menstrual cycles and very bad cramping, but not pain, not to the point where I literally told my husband one night, I want you to take a knife and I want you to dig into my ovary and take out whatever is causing this. And he said, you never asked me once to like physically do anything to you. And I said, I know, but I'm actually genuinely serious. Like, unless you get me to the ER right now, you're going to have to go and hear yourself and get this out. So that was the first time I'd ever experienced pain that severe.
What were
Yeah.
what were some of your symptoms that that you developed that caused you to think, or caused your doctors to think endometriosis to begin with?
A lot of pain. I would have irregular bleeding. So, and either really heavy or really light, but it would come constantly and on and off. It was very sporadic, which was one of the things they said, oh, this might be endometriosis. A lot of inflammation at the time. They would do their testing. And those were the three main ones. When they looked at me, they said, this shouldn't be shedding this way. You shouldn't be shedding sporadically. And I shouldn't have had, now looking back, the scar tissue I had while I was shedding sporadically. So those were the three, the pain and the random bleeding and sporadic bleeding were the main ones that caused them to think that.
Did you just go to one doctor in the hospital, or did you go to several different doctors?
We went to 2 different emergency rooms,
Okay.
hoping the second time for a different response. And at both of them, it was the same. It was the same concept when we went and saw the OB, right? You might have this, you might have this. And it wasn't until almost a year after it started, actually, when we were in California, that the doctor here actually gave me a concrete and showed me my results, showed me all of my scans, showed me exactly what I looked like, which I don't really ever want to show anybody, but yes.
Elizabeth, I have a question. Whenever that doctor you were just mentioning, how did he know that you had buildup of scar tissue? Because I know a lot of doctors want to say that they want to cut you open to be able to see what's really going on. Did he do a scan or?
No, he did his ultrasounds, and he said, based on what he heard, he said he had actually done a lot of research on scar tissue buildup. So for him, it was an area that he had specifically already looked into, but he did say, I do have to operate. He said, I think this is what it is. I do have to operate, but I don't think it's endometriosis. He said, I think it is just the scar tissue buildup. So when he went in, he did still have to do an experimental surgery to find it. But we knew at the same time for the pain, he said the ablation would help with the pain. And so he was already going in to do the ablation. And then while he was in there, we signed off that he could look around and find scar tissue. And he did. He found a lot of it.
Wow.
Still experimental surgery.
Okay.
What caused all that scar tissue to build up? Did he tell you?
He did not tell me. He said that it could have been due to, he did say it could have been due to environmental toxins.
Mhm.
It also could have been due to poor surgery when I had C-section with my second daughter. But looking back on it now and finding out more of the science behind inflammation and the connection of inflammation to your hormonal balance and your menstrual cycle, I do think it was directly correlated to the toxins that were building inflammation into my system and then causing me to have sporadic menstrual cycles. Yeah.
Oh my gosh. I can't even
Wow.
imagine, if you would have had that surgery and then found out later that it was mold.
Well, it wouldn't have helped at that point, right? Like the hysterectomy wouldn't have helped. So I still would have been going through recovery from surgery with a body still full of toxins, which wouldn't have helped. That would have taken a very long time. And I wouldn't have healed properly, knowing some of the autoimmune condition I have now from the mold, I wouldn't have healed properly. So I'm just incredibly grateful that I found the doctor I did in California and that he was able to find the actual problem. And he did not think I was crazy. We talked about mold. He didn't think I was crazy. He listened, he took it into consideration. which is rare. As we all know, we've all met doctors that have the exact opposite approach to that. So it was just a very refreshing experience coming out of mold and so many doctors not knowing what was happening, right? To finally find one out of a dozen that listened and acknowledged and actually found the root of the source.
Wow.
Yeah.
I took some notes. I'm going to look into some of the That's awesome.
Well, I mean, we've talked about this before, but you have to remember when your hormones are off balance, your menstrual cycle will go off balance. So it'll stop shedding the way it's supposed to shed every month. And when it stops shedding, it just builds up a thick layer in your uterus. So when it does that, if you already have any form of scar tissue, so if I had scar tissue from my C-section with my daughter, if there was even a little bit there, the buildup from not shedding properly each month would have just built up, and it would have just added to the scar tissue and attached to it, and it would have just continued to grow. So when he went in, there was just, he said it was overwhelming to see how much scar tissue was there and the buildup from that. So I look at that and go, that had to have been a combination of a poor surgeon with my second daughter and toxins causing my body to not act properly and not shed properly and just continue to build on top of that. Yeah.
That's crazy. I can't tell you how many women I talk to though that literally get told, let's just do a hysterectomy. You know, it's like, okay, but I get it, because honestly, if my doctor, whenever I was going in, had offered me to do a hysterectomy because of the amount of pain I was suffering from, I would have just jumped on the table.
Yes.
And said, do it, because just like you, I mean, the pain was so severe. It was debilitating pain, you know, and with all the other symptoms that came along with it, such as the anxiety, which I related to the hormones, you know, because I developed anxiety in our toxic home, which I've never had an issue with. I had tons of hair loss, so I'm thinking hormones. I had tons of acne issues in my 30s develop, you know, so hormones, you know, and then all of a sudden my menstrual cycle, and on my paperwork at my OB, it's even listed that I put that the month that all my issues started was the month I moved into this toxic home. And that's when my menstrual cycle went from light, you know, to pretty regular, like every 28 to 38 days, to sporadic and heavy period pains, extreme heavy bleeding, and just, you know, and then I also had GI issues accompany that, you know, and so I don't know what was going on. And I mean, I definitely I would have considered it. I would have done a surgery if my doctor would have offered that to me.
And it's so hard too, because I look back on it and you wish you would have been able to do some of the research that we can do now. And you wish you would have been able to think through which symptoms were toxic mold related, just outside of menstrual and hormonal, right? Like a lot of the anxiety and the stress. Because I remember that too, just being in a panic, thinking we have to do this. We just have to do this. And wanting to know which of those could be separated now and go, these were specifically due to menstrual issues and hormonal issues. And these were due to like neurological issues that were happening, and how they're connected is still baffling to me that they are connected. Like, yeah.
And so many people like to, I don't know if y'all heard this a lot, but from other people, not just your doctors, but maybe you're just stressed. Stress can cause a lot of these symptoms. If I swear, I wanted to just, I was going mad. I was like, I am only stressed because I've developed these symptoms and they're not going away. Like, that's the only thing stressing me out. I'm not stressed at all with anything else in my life. You know, I'm not stressed because I'm a mom. I'm not stressed because, you know, I'm a stay-at-home mom. I'm not stressed because of my marriage. Like, it's my health. Something's wrong with my health. It's not getting better. I don't know why. And we're just guessing here, you know? So.
Yeah. I heard that from a lot of doctors.
It's just stress.
A lot of. Oh yeah. And they want to put you on antidepressants, SSRIs, SNRIs. And they're there to treat symptoms and not really find the root cause of what's causing our issues.
Lauren, tell us about, what happened to you? How did mold affect your hormones and thyroid, and what was your journey with that?
So it's funny, I never really thought, I never connected that mold was causing it until I really got out of the moldy home. For years, I've always had a really heavy cycle and pain, but never pain like what I had in that house. Never like that. I could still function. I could still go to work during my cycle. And so progressively over the years in that house, my cycle got really, really bad to the point to where I was scheduling things, family vacations around it. I was making sure that, you know, when I thought I was going to have my cycle, that I didn't have anything big planned that weekend. And I was always paranoid that we were going to get invited to a wedding or something, you know, or something big that I wasn't going to be able to go to, because I could not walk for those first 2 days. I was on the couch with heating pads, taking medication to help with the pain, and it wasn't doing much. So you're just sitting there like breathing through the pain for 2 days, and then it gets a little better and you can get up and do things. So it got worse. And I remember it was in the beginning of 2019, and I had lost faith in so many OBGYNs or gynecologists because of my experiences with them in the past, and how they hadn't really listened to my concerns, like we're kind of talking about, like, oh, you're stressed, or you need to go on an antidepressant. So I'm like, I know something's going on with me. And I'm at my regular doctor, and it's a nurse practitioner that I'm seeing. And I'm like, hey, do you know of a good gynecologist or something? And she's like, well, you know, why? What's going on? And I told her, and she asked me about my cycles. And she goes, you know, they're not supposed to be that bad. And I'm like, no, like, I know other people don't have them this bad, but I know other women do. And she goes, let's do a hormone panel on you and see how it turns out. So it's kind of ironic. I get the blood drawn that day, and I start my period. It's 2 days later. And I'm in the kitchen, and I just like, I'm buckled over in pain. I'm like, in my head, I know I need to get to the couch. And I get to the couch, and I end up passing out on the couch from pain. And Skylar's on the couch with her tablet. And I wake up an hour later, like, what happened? And it scared me. So I call the doctor and I tell her what had happened. And they're waiting on my results still. And everything came back normal, except my thyroid was a little low. And she was a little concerned about that. And later, I ended up looking at thyroid labs that I had had in the past, and they were always on the low side, even when I was pregnant. I don't know if that was something, you know, that was happening, you know, a sign because I was in the moldy house, because I never had that problem before living in the house. So I think that could be like a signal, if anyone is wondering, because your thyroid affects your hormones, like it's all connected.
Mm-hmm.
Well, so when I called them and I told them that I had passed out from pain, she ordered a transvaginal ultrasound and went and had that done. And they found cysts on my ovaries and on my uterus. And like they call it a Nabothian cyst, I think. And it was pretty large. And I'm like, okay, so the cysts are causing the pain. She said, you need to go see your gynecologist. I'm like, great. I don't have a great one that listens to me. So I took the ultrasound on the DVD to my gynecologist, and I gave it to them ahead of the appointment so that the doctor could look at it, and reminded them when I got to the appointment, and go in the room. Doctor comes in. I'm like, hey, did you get a chance to look at the ultrasound? He said, what ultrasound? Like, did I order it for you? I said, no. He goes, then no, I didn't look at it. And I was like, are you freaking kidding me? Like, I'm here for a problem, and you're not even going to look at the ultrasound that was trying to help figure out what was going on. And so he asked me what the ultrasound says. And I'm like, I gave the printout to your, you know, receptionist. It should be in my file. So he's looking at it and he's like, I bet you have endometriosis. And I said, okay. I said, how do you know that? And he's like, well, I don't know for sure. The only way I will be able to know is if we do surgery. And just like you, Elizabeth, we do surgery and we see. And when I'm in there, if, you know, things are bad, then we'll do a hysterectomy. And I was like, whoa, like there's nothing y'all can do ahead of time to see if this is really what I need to do. And I just had a really hard time believing him. And I said, I don't want to do that. And he's like, okay, well, there's not much else I can do for you and your pain that you have every month. He did prescribe me a medication. I think it's I saved the sheet of paper. I never got it filled, but I think it was a blood thinner, because when I took it to the pharmacy to ask him about it, they were kind of shocked that he prescribed it to me. Meaning, like, I think he did that because he was thinking that it would help my cycles not be as bad. I don't know. But he also recommended birth control. And I was like, no, absolutely not. I was on that for years. I know that's part of my problem. He was like, how do you know that? The internet? And I said, look, I just don't want to be on birth control. And he was like, I don't understand why. It was this really rude conversation. I was like, I'm done here. And I left and was looking for another gynecologist. Meanwhile, we find out about the mold in the house. I'm still dealing with these painful cycles, and a new symptom comes up. And it was like back to back up until we moved out, and it was horrible. So on top of the cycles, I was having what I thought were UTIs, but they weren't UTIs. And I know this is the topic that this video is on, so I'm just going to just be blunt with everything. But like, I didn't have burning during urination, but I had really bad pain down there, and it just hurts so bad to where I couldn't think about anything else. So I'm just breathing through it. I'm hunched over, but it was the kind of pain where you just want to like punch a wall, you know, like, why is this happening right now? Like, I didn't do anything to cause this. I'm not on my cycle. Why is this happening? And so remember, it was like 3 of them back to back within like a month and a half or 2 months. And I go to the Ready Clinic, and I'm driving there all tense, you know, and just in pain. Like, I just got to get there. They're going to give me an antibiotic. It's going to fix it. Get there, and they do the test. You know, we pee in a cup. They test it for bacteria. There's not any. Like, what the heck? It's in. So the third time I go, I get a good nurse up there, and she's looking at my file, and she's like, look, you've been here, you know, 3 times recently. You've never had a UTI. What's going on with you? I said, I don't know. And no one can tell me. And she's like, okay. And she starts asking me if I have any of these other symptoms. Do I have constipation? Do I have like really bad cycles? I'm like, yes, all of that, all of it. And she goes, I would go to a gastroenterologist. I don't know if I'm going to say that right. You know, a stomach doctor, get him to look at things, see if there's something that could be like, maybe it feels like you're having lady issues and it's really your gut. Well, I'm like, okay, that could be something, right? Well, it wasn't, because it ended up months later that my mold doctor actually ordered a colonoscopy endoscopy, which I was like 100% sure they were going to find that I had colitis or something because of the stomach pain I have all the time. And they didn't find anything. They said that I was like perfect. And I was in shock. And so it's kind of like this whole time I've been narrowing it down and taking care of this and finding a doctor, a gynecologist that's going to really be able to figure out what's going on. That's kind of been last on the list. I've been trying to heal from mold and Lyme and all of that. Well, meanwhile, being out of the house and healing from mold and Lyme, my cycles have gotten better. Like, they're not as intense as they were. I'm not like on the couch the first 2 days. I can kind of move around. I still have painful cramps, but I'm functional, and they're not as heavy as they were either. And so I look back and I'm like, if I would have listened to that gynecologist, I would have probably ended up with a hysterectomy. And I did see a functional gynecologist last year because I was thinking, okay, go to a functional medicine gynecologist. She's going to be able to figure it out. And one thing that she said is that she's positive that I do not have endometriosis, because usually when you have endometriosis, like the scar tissue kind of grows over everything, and she can't move your ovaries around during your exam. And all of her patients that have had endo have had that issue. Everything's kind of like stuck together. And mine was not like that. So it just kind of blew my mind that if I would have listened to that doctor, that would have happened. And I just wonder how many women out there, you know, were in the same situation as us, you know? It's crazy.
I've heard from a lot of women, because I've talked to like over 2,000, and a lot of them, and that's one of the first questions I ask whenever I'm talking to either the husband or the wife, is I ask them about hormone related issues with the wife, and are they having, menstrual cycle issues, a change in their menstrual cycle? Are they having, hair loss, anxiety development, depression, brain fog, skin issues, and it's always night sweats.
Yeah.
Gosh.
Night I had, yeah.
Did you have that too, Elizabeth? Night sweats?
Yeah.
And it's crazy, but majority of the time, they always say yes, 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 yes. And then when I hear from the ones that, I hear from later on down the road, it's the same story. Everything got better once we got out of the toxic environment. Same story with me too. Once we got out of the toxic environment, my menstrual cycle issues that I would have, paid money for anybody to take out my uterus, if that would have solved the problem, went away. And, I've definitely, there's been women that I've gone through and had hysterectomies, and after their hysterectomy, they're still having issues. And then of course, then they find out that they have mold in their house. And then once they get out and they get the testing done and they determine they are positive with mold in their body, but as they detox, those symptoms that still were there after the surgery go away.
Wow.
So, and other things I've heard is doctors saying, well, maybe you're having premenopause, to a woman in her 30s.
Yes.
Maybe it's
Yeah, that's crazy. I learned a lot about doctors like that. They don't, like, during both of my pregnancies and deliveries, they didn't have answers for things that happened. Mm-hmm. And that was right when it really made me start to wonder, why don't they have answers for this? Like my first pregnancy, I was leaking fluid. I was leaking amniotic fluid for a long time. And so they were monitoring me in my last weeks. And after I gave birth to Delilah, when you give birth to the placenta, it was ruptured. I was like, how'd that happen? Like, what caused that, And it's just, they don't have an answer for you. I got sick afterwards too. For a week, they couldn't tell me what that was either. But antibiotics fixed it, which was strange. Like, so many weird things they couldn't answer.
Well, Lauren, the pain that you mentioned where, for the first 2 days, I had that too. And I think you did too, Elizabeth, to where the pain was so bad. And I've never had any sort of pain during my menstrual cycle. And that was one of my big red flags, to whenever I woke up one morning, one of the first few months that we were there in this toxic home, I couldn't even bend my knees to get out of bed because the pain in my lower abdomen was that severe. I literally could not get out of bed. And yeah, all because of mold.
Yeah.
Just say too, Lauren, as you were talking about the UTIs, mm-hmm. I didn't mention that, but I did not know you went through that. I went through the exact same thing. We saw multiple doctors, multiple, for testing within a short time frame. There's no bacteria in your urine. I don't know why you're experiencing this. Maybe it's a fungal infection. Like maybe it's this, maybe it's this. We just don't know. And then you go back 2 weeks later. Why am I experiencing this? Is it burning? No, it just hurts. Like, yeah. Should not be hurting when I pee. Like it shouldn't. Yeah. Same thing, saw a gastroenterologist where we were living at the time in Texas. They did a colonoscopy, same thing, found nothing. He said, I don't know, your stomach's just really inflamed. I think it's gastritis. And put me on 2 medications for it, which I took for a little while and they didn't do a lot. So went back in, said, it's still hurting. He said, oh, I'm sorry, I don't have an answer for you.
Oh my gosh.
Same thing, we got out and started to heal and the stomach pain went away. And the only time I experienced it was if we end up in unintentionally in a moldy environment, my stomach pain will come back, the pain will come back. That happened. We found out we had mold in one of our vehicles in the last year. And the same thing within the time frame I was riding in it a lot, my stomach started to hurt again. And I went, oh, we've done this before. Like I'd rather not get another colonoscopy just to make sure.
Yeah.
Yeah,
Wow.
I thought about that until you mentioned it though. So I wondered, there has to be more women that are having those same symptoms at the same time going, man, if you think you have all these UTIs and you don't, check your surroundings, like check your environment.
Or, being diagnosed with hypothyroidism or
Yes.
hypothyroidism, or I was diagnosed with, so they did do a test on me and they did say that I had bacterial vaginosis, an extremely bad case of it. And they gave me this medication that was extremely strong, I guess, I don't know, but I was telling Josh, because I lost 4 pounds within 3 days on this medication.
Wow.
Because it made me go to the bathroom I could not stop. And I was like, what's going on here? And I don't know if and I'd have to go back and look it up, that maybe there was an antifungal sort of effect to that medication that was helping me detox. But of course, after I went through that medication, the pain came back. And when I went back to the doctor, I was kind of at my wit's end whenever, cause she did a transvaginal ultrasound as well. And she's like, yeah, you have nothing going on here. You're fine. And she was pushing birth control for me to start. She also did blood work to see why I was complaining of fatigue. And, when I went back, I just was kind of like, okay, well, I mean, we're done here. Because they weren't, I don't know, it was very frustrating because they weren't listening to me.
Yeah.
And it was just kind of guessing, of what's going on. And then whenever I would mention what I thought was going on, which I was wrong too, it wasn't endometriosis, because I thought I had endometriosis and it wasn't, or diverticulitis or IBS. They weren't really testing me for everything. So.
Yeah. And that's the thing, we get online and we're trying to figure it out because we don't have faith in these doctors to help us with it. And we're looking at symptoms. I think one of the symptoms that I thought correlated with what I was going through with these issues was the vertigo and dizziness too, because it would get worse during my cycle, which is, I think, one of the reasons why I passed out that one time. But the vertigo, that's a big sign of mold illness too.
I had vertigo too. Did you, Elizabeth?
Yep. Yeah.
So we all had pain in our lower abdomen to where we couldn't move, change in menstrual cycle, heavy cycles.
Heavy clotting, did y'all have that?
Yes. What? Very heavy clotting.
Oh yeah, tons of clotting. And tons of clotting, GI issues, constipation, diarrhea.
Yes.
Fatigue
issues.
What was the last one you said?
Urinary issues.
Yes.
Urinary issues, yes.
Yeah.
Night sweats.
Oh my gosh, the night sweats.
Skin problems, hair loss. Anxiety development. And of course, it's so easy for people to look at a female and especially if they're a mother and pawn it off to, well, you have a lot going on. It could just be stress.
Yeah.
Yeah.
Yeah. I look back to even after giving birth to my second daughter, Skylar, after that, we were in the house 24/7 because it was when I had stopped working and became a stay-at-home mom. And I wonder if, you know, because I fought getting on medication for postpartum depression. So that's what I'm trying to say is I wonder if it wasn't really postpartum depression, if that's when maybe my symptoms were starting that far back.
It's funny that you say that because my son was 10 months old whenever we moved into the toxic home, and I didn't develop any postpartum depression at all. I was just the happiest mom to have this beautiful, amazing little child.
And
And
me
that's,
too. That's why
yeah,
it was like, it didn't feel like postpartum depression. So when I talked to my
yeah.
doctor about it, she was like, no, that's what it is. I'm like, no, I'm happy, but it's like my hormones are just crazy. I just cry when I'm happy and it doesn't feel right.
Because somebody mentioned that to me too. They were like, "Oh, well, postpartum depression can, develop even when your child's, a year, 2 years old." And I was like, "What?" But I mean, I don't. I mean, I'm not. So I looked it up, and I was like, "Did I develop all of a sudden postpartum depression like out of the blue?" Which didn't, like you, it didn't make any sense to me. I mean, I was happy to be at home with my child, happy to be taking care of him 24/7.
Yeah.
So yeah, it was crazy.
Yeah.
I had kind of the opposite experience with that, where I did have postpartum, but the antidepressant they put me on for it as I healed from mold with the doctor we found in California that we now see on a regular basis, not my OB, just the specialist we see. We figured out that about 2 years into my healing process, I started to shake a lot. And she took me and she said, "You don't need this medication anymore. Your body's reacting negatively to it." And so we look back and go, well, I wonder if my postpartum turned into just the toxic molds because the medication wasn't doing its job anymore. Like my body was legitimately rejecting this medication. That was the child that it was going through it. It ended up rejecting the medication entirely. So when the doctor said you have postpartum, put me on the medication, a year and a half, 2 years later, they were still saying you have postpartum. And my specialist was saying, you definitely do not have postpartum anymore. Like your body's rejecting this antidepressant. It was just mold and you're healing from the molds. So you don't need this anymore. And I was blown away a little bit by that, going, that just masks the whole set of symptoms for me with my hormones.
Yeah.
Yeah, because nobody wants to be on a medication if you don't have to be on one. After
Yeah.
you don't have anything put in your system that doesn't need to be there.
And I'll tell you, like so these medications that they put you on, I don't know which one you were on, Elizabeth, but they affect your serotonin or your neuropinephrine.
Yes.
So there's SSRIs and SSNRIs. And I knew a lot about them when they prescribed it to me because I didn't want to get on one because we had always felt like when women in our family got on them that they couldn't get off of them. There was like some kind of genetic serotonin imbalance in our family is what we were thinking. Now we're thinking something different. But I've done a lot of research on them and they scared me. So when I got on it, I was like, I'm going to get off in 2 years. Well, over the years, I was experiencing symptoms that I was chalking up to being symptoms from the medication. So I tried to get off of it and that didn't work. Because when you go to your doctor and you tell them that you want to get off of it, they're like, okay, we'll just start taking it every other day. Well, I was getting these like electrical shocks when I would try that. And so I started doing research online and I had to get myself off of it on my own. And it took years. In fact, I finally am officially off of it as of a few months ago. I was taking just a little tiny bit. I tapered myself off like over years. So, but it's crazy how much those can affect you too. And I agree with you 100%. It can cover up and mask symptoms that you're experiencing that are being caused by other stuff. So, but I mean, there's Facebook groups completely dedicated to getting off of those medications because it's so hard.
Mm-hmm.
So.
There's an article, I can share the screen real fast, but there's a doctor that was talking about how mold affects the hormones, some tests that you can do too. Because a lot of times, in his article, he was talking about how doctors will just test your TSH levels,
Mm-hmm.
and they'll miss the whole picture if they just do that. Y'all want to see it real fast?
Yeah, I do, because I think that that's important for people to see. I think that you can get your hormones tested by your doctor and it'll look completely fine to them when it's not.
Let me see. And to test for mold, because obviously most doctors in the mainstream medical aren't going to be thinking mold, and they're not going to test for it. There are some tests that you can do. First off, you can find a doctor that's, not only a medical doctor, but one that actually knows how to test and treat people for mold. But there's tests you can do, such as a urine mycotoxin test through real-time labs or Great Plain labs. You can also do a blood test to check to see, what kind of species of mold entered your body. The sinus cavity one to see if you have an active fungal growth as well. Through doctors that actually know how to test for mold. And if anybody's out there wondering, how do I find out? First off, go find a doctor that knows how to test you for mold and treat you for mold, and then they'll run the proper test on you. But you can also order some tests yourself, such as the urine test through Great Plains or real-time labs. Is there any other test that they can order online themselves, Lauren or Elizabeth, that you know of? I know there's that Myco lab, that blood test.
There's the one that tests for mycotoxin antibodies, so mycotoxins that molds put off that make you sick. But these are all out of pocket tests. There is the test that you can have your doctor run. I think it's LabCorp that tests for the antibodies to molds. But I don't think you want to stop there. I think that could be a starting point that insurance might cover, just to kind of give you an idea if you're being affected by mold.
One thing that I hear a lot about is a lot of mainstream medical doctors will send their patients to get allergy testing done. There's a big difference between allergy testing and testing to see if you've been exposed to mold.
Yes. Yeah. I've actually just had allergy testing done, and I'm not allergic to mold, but yeah, I'm really sick from it. So I can attest to that. Apparently I'm allergic to horses and cats and dogs and a bunch of weird grasses, but not molds. And I was like, for sure, I'm going to be allergic to mold, and, mold's toxic. But no.
A lot of people think that because they don't come back positive for showing an allergy to mold, then it's not mold causing them to be sick. You have to remember that mold also produces what's called a mycotoxin, which is a poison. And there's different types of mycotoxins, and the only way to test for that is to actually go get the proper test to see if you've been exposed to it. Yeah. Allergy testing is only going to let you know if you have an allergy to mold, but not if it's actually affecting you personally right now.
Right. And there's a lot of doctors that believe that too, that you have to be allergic to mold for it to make you sick, which is concerning, because any mold can make anyone sick if they're breathing in enough of it.
Can y'all see this?
Mm-hmm.
Okay. So this is an article that I found. I found it quite interesting, by Dr. Hagemeyer. And he talks about mold illness and thyroid disease, how mold toxins affect your thyroid gland and your immune systems. He goes on to say patients who have mold illness or mold toxins almost always have some kind of thyroid disease. When you have mold toxin illness, getting the proper diagnosis and treatments can be incredibly challenging unless your doctor knows what to look for, which is what we just kind of talked about. You see too many doctors working with patients who have mold illness miss this, because people with mold illness have thyroid blood work that is a little different than someone who has textbook hypothyroidism. We'll skip down. He says, I will explain how mold affects your thyroid, how to get your thyroid properly tested when you have mold illness, what to look for on your blood work, and towards the end, I'll talk about the tips on how to support your thyroid when you have mold illness. He goes on to talk about how mold affects your thyroid here. he's discussing mycotoxins, specifically the poison. He says mycotoxins that are released from molds are toxic to the entire body, including the thyroid. Mold affects your thyroid by encouraging thyroiditis, which is inflammation within the thyroid gland. This inflammation is typically caused by cytokines, which are immune chemical messengers that drive and push all this inflammation. Several studies have shown that Aspergillus mold triggers thyroiditis. So we know that mold can trigger inflammation. But there are several other problems we can see on blood work. He says 90% of patients who have mold illness have low MSH levels. MSH stands for melanocyte stimulating hormone. And when someone has low levels of this, it puts them at an increased risk of pain, inflammation, fibromyalgia, mood disorders, sleep problems. People with low MSH also find themselves with increased thirst. Did y'all have that? I did. I had,
Yes.
I was.
Yes. They
Y'all-
checked me for diabetes at the time because they were like, you're drinking, you need so much water, you must be diabetic, and nothing showed up positive. Yeah.
Yeah.
So did my son Sebastian and Josh. We all had an increase in thirst. Frequent urination. I mean, you would think that if you have increased thirst, you're gonna have frequent urination, but I had that too.
Yeah, waking up, I think that's a good example too. Waking up a bunch in the middle of the night to go to the bathroom is a sign something's not right.
My son just turned on the TV. Hold on one second. Okay. So he says it increases your thirst and frequent urination. That's because MSH affects your antidiuretic hormone. If that's not enough, MSH also increase risk of obesity or weight gain because it increases hunger. And we all know what happens when you walk around all day feeling hungry. I had the opposite effect. I actually lost a lot of weight in our toxic environment versus gain weight, but I know a lot of people that gain a lot of weight too, and they can't lose it.
Mm-hmm. I gained weight. I couldn't lose it. I was trying to. And when we moved out, it was it's like 20 pounds just came off of me really easily.
He goes on to say mold illness affects leaky gut, which further puts you at increased risk of autoimmune disease. Elizabeth?
Yeah, we did all the blood work testing, the nose testing, we did the antibody testing, and then my doctor did do allergy panels specifically because she thought after the gastritis being ruled out that I had leaky gut. And the allergy panel did show, for me, it showed an allergy to specific types of mold, but it also showed massive leaky gut. And due to that, I did actually get an autoimmune condition that actually Lauren and I both have. So it was very much this where, man, the inflammation too, it talks about, which I think people need to remember, right? Like the toxins go to your brain and it causes inflammation there, which causes inflammation in so many other parts of your body, which is why doctors can't figure out what's going on, because they don't just think all of this could be due to inflammation from mycotoxins. Mm-hmm. So the leaky gut comes with that too, right? Your stomach is pissed off at the world at this point and it thinks everything is attacking it. Mm-hmm. So we're having issues to food that you don't know about, and you can't eat certain foods, and you're wondering why certain foods are causing symptoms that were similar to mold. Check leaky gut, like have your doctor check for leaky gut, because once we got that fixed, my allergy panel went from an entire page of over 100 food allergies. I had only 6 to start with that didn't check up as me being allergic to them, which we knew wasn't correct, to now there are 6 that show up as actual food allergies.
Is this the food allergy test or sensitivity test?
The food allergy test.
Oh, okay. Mm-hmm. Okay.
It does affect your leaky gut very much so.
It affected mine too, and I developed food allergies because of mold, and it definitely gave Josh, my husband, and my son a leaky gut too.
Yeah, me and my mom both have it too.
Dr. Hagmeyer says that it affects your adrenal glands by altering your DHEA and cortisol levels, and mold increases the sensitivity of your immune system, putting you at risk for increased sensitivity to chemicals. How many of us I have chemical sensitivity now. How about you? Including food allergies and environmental allergies. So all of us just answered yes to food allergy development too, environmental allergies. If mold causes inflammation in the body, which it often does, you can also struggle with low T3. Understanding, and then he goes into, there's different kind of thyroid issues that can develop because of mold. He says, understanding non-typical thyroid presentations in mold illness patients. Like I said, there are 3 non-typical thyroid disease problems I want you to be aware of when it comes to understanding the thyroid mold connection. And if you have a pen, you may want to write these down because there aren't too many doctors talking about these or even explaining them. Here they are. Non-thyroidal illness syndrome, sometimes called euthyroid sick syndrome or functional hypothyroidism, subclinical hypothyroidism, and autoimmune thyroid disease. Now, if you are not familiar with the term subclinical hypothyroidism, autoimmune thyroid disease, euthyroid, non-thyroid illness, don't worry, I'll explain what exactly they are, and most importantly, what you need to look for on your thyroid blood test if you are someone who has mold illness or suspects mold toxins. I can't stress the importance of getting your thyroid properly tested. Here's why. He goes on to talk about some other tests that you can do. I'll post this because this is a very long article, but he goes on to discuss how a lot of times doctors miss thyroid problems because they only test for your TSH and they're not testing some other things that they can look at, which can properly maybe diagnose you. But I'll post this as well. But I thought that was kind of interesting.
It is, yeah.
Because a lot of people that I speak with also get misdiagnosed or diagnosed with thyroid diseases like Graves' disease or Hashimoto disease, or hypothyroidism or hyperthyroidism. It's just insane, you know,
Yeah.
and when it's really mold illness.
Yeah. Like
So-
I was told that I'll be on thyroid medication until I'm fully healed from mold illness, that I don't need to stay on it forever. So I haven't really fully understood why I was on it. I know that it was because it affected the mold hormones and stuff. So this is a good article.
Elizabeth, didn't you have something to share too?
No, I was just gonna say, if, like, I'm glad you're presenting this. And if anybody watches this, like, remember, it's okay to ask questions. Like, bring your own information into you with the doctor. We've talked a lot about how we've all had doctors that haven't understood what we've gone through or understood mycotoxins and how they can affect your body. So don't be shy to pull the 3 things from this article and go to your doctor and say, please check these as well and push for it if you think that it could be your thyroid. Like, don't be shy about it, even if you're exhausted.
Yeah.
I think it's a really good point. That's one of the things that, you know, going through this experience has taught me is ask a lot of questions to your doctors, and also don't be afraid to, you know, say, you know what, like, you're not giving me my answers. I'm going to go find somebody else.
Yes.
Yes. A good doctor is willing to actually look into what you're talking about and do their own research or admit. The doctor we have now, a new mold just popped up on my most recent allergy panel. And I said, well, where does this typically grow? This is a mold I haven't heard about. Where does this typically grow? How does it typically sporulate? What process does this need to go through a climate? And she said, honestly, she goes, I don't remember, but I know I have this in this article. I'm going to read it today and email you later today or call you and let you know exactly what I find out. And I have so much respect for that, instead of a doctor saying, well, I just don't know what it is, and brushing it off or ignoring the comment of, well, is this a toxic mold? How is this going to affect me? And then going, oh, it's fine, it's fine, it's fine. Like, here's medication.
Yeah. I completely agree.
You have to basically grow some cojones and be very bold with doctors.
Mm-hmm.
Yeah, and especially, I mean, if it is mold, you have to remember most doctors aren't taught in medical school about mold illness. So they literally and honestly don't know what's going on with you because they don't have the education about it. So it's not their fault that they don't know. But that's where it goes back to you of if you're not getting your answers, or if your doctors are just guessing, and that's crazy that your doctor, Elizabeth, was just going to go in and basically potentially just do a partial hysterectomy on you, or you, Lauren, and do a hysterectomy.
Yeah.
When they weren't absolutely 100% sure that it was endometriosis,
Yeah,
you
Yeah.
know?
I know.
So, you know, if your doctor's just guessing before you go through with a surgery that, you know, you may not even have, go get tested for mold, you know, have your home tested too, you know, but I would say go get tested for mold first and see if you have mold affecting your body. And if so, that could be your answer, and that could be your culprit to all of your symptoms. Also, look at other family members in your home. Is anybody else suffering from symptoms? That was a big thing for me. You know, my husband and my son and even our dogs were affected. My dog developed anxiety. They had excessive thirst. They had GI issues. They had skin problems. My husband had fatigue. You know, he had mood disorders. He had nosebleeds. My son, you know, had neurological issues develop in the home and GI issues. So look at also other people in your home. Is anybody else suffering from any sort of symptoms? Which might make you think that maybe it's something in y'all's common environment that's causing you guys to suffer, you know, because mold affects everybody differently. It's not going to be the same for everyone. Anything else, guys?
No.
I don't think so.
No? Okay, well, thank you guys for coming on and discussing your stories today. I know this is probably going to help a lot of women who are probably thinking right now that they're going crazy because they're not getting answers, and hopefully it may actually get them their answer. So I appreciate you guys sharing your story.
Yeah, absolutely.
I'm gonna log off right now, and we can talk after I stop recording this, okay?
Okay.
Give me 1 second, I'm gonna stop screen sharing too. All right, bye Elizabeth.
Bye.
Bye
Bye.
Lauren.